Hello viewers, welcome to another vlog, and today's topic is acute leukemia or blood cancer. So what is acute leukemia? Acute leukemia is a condition when there is a rapid proliferation of the blood forming cells within the marrow. Normally, as we know that there are mainly three cellular components of blood. The first one, that is red blood corpuscle, which usually carry oxygen and carbon dioxide. The next one, that is WBC or white blood corpuscle, that is concerned with our protection against a lot of organisms or foreign invader. The third most important cellular component of blood, that is platelet. Platelet is concerned with blood clotting. So if there is any cut, there is bleeding, slow at that time platelet will come into action and it will take care of the blood clotting. So these are the components of blood. These are the cellular components of blood. Now there is a regulated production of these elements from our bone marrow. So there is a fixed rate of production of this cellular components, as well as there is a fixed rate of destruction. So the number remains within a range, within a specific range. In case of leukemia or blood cancer, there is uncontrolled proliferation of these elements. There may be there usually there is proliferation of a single element, but sometimes there may be increased proliferation of multiple elements. So in case of blood cancer, usually the WBC or the white blood corpuscle, that is being produced at a higher rate. So the number of WBC will be quite high in case of blood cancer. The WBCs that are produced in blood cancer, that will be non-functional. They won't be able to serve their function. So there will be more chances of infection. Will be fever. Also, the marrow that will be replaced by the abnormal white cells, and the relative number of the red cells and platelets, they will be decreased. So the number of red cell will be decreased. That means there is anemia. So there will be problems regarding transport of oxygen and carbon dioxide within our body, that will lead to various symptoms like weakness, lethargy, exertional weakness, dyspnea, sometimes chest pain. These are usually seen with low hemoglobin, low RBC counts. Due to low platelet count, there may be presence of some bleeding manifestations. There may be bleeding from gum, there may be bleeding in urine or stool, there may be bleeding under skins, which are known as purpura or ecchymosis, depending upon the size. So there may be a lot of presentations in case of acute leukemia. There is another symptom that is known as lymphadenopathy. That means there is swelling of the lymph nodes in different groups. There may be presence of fever, there may be presence of weight loss, there may be anorexia. So there are a lot of features of blood cancer. The most common are presence of anemia, presence of fever, there may be presence of infection, there may be bleeding manifestation. So these are the common features of acute leukemia. Now, how do we diagnose acute leukemia or blood cancer? The most common test that is commonly performed, that is CBC. CBC means complete blood count. In case of complete blood count, we get an initial idea about the component of the blood, about the increased number of cells within the blood. So you will get to see that the numbers of WBC will be increased. There are a lot of WBCs within the peripheral blood, and sometimes the count is so high that can cause a lot of symptoms like increased number of cells that can lead to various symptoms. Also, to diagnose this condition, we need to, as I have said, that we need to do a initial investigation, that is complete blood count. By complete blood count, we can see the abnormal cells that is present in the marrow, their percentage, their morphology. That means the structure of those cells, depending upon the structure, depending upon the antigenic expression. The leukemia is categorized into a lot of subgroups, and depending upon those subgroups, sometimes the treatment may get varied. So the initial investigation is complete blood count. There is another investigation that is known as flow cytometry. Flow cytometry helps to detect the antigenic expression of the cells. That means in different types of leukemia there is different pattern of antigenic expression. So to detect those antigenic expression and thereby detecting this specific subtype helps us to plan the treatment of the specific subcategory of this disease. There are a lot of types of acute leukemia, so it is very much important to detect the specific type of leukemia, and thereby we will decide the further therapy for that disease. There is another important test in diagnosis of leukemia, that is bone marrow investigation. In bone marrow investigations, there is bone marrow aspiration, and there is another part, that is bone marrow biopsy. In case of bone marrow aspiration, we get to see the abnormal cells, their morphology properly, their proportion of the cells that is present in the marrow, whether the marrow is cellular or hypocellular. So these are some of the important informations we usually get from bone marrow aspiration. In case of bone marrow biopsy, we used to have a better information in terms of distribution of the cells within marrow, whether the abnormal cells are present at the paratrabecular region or at the center of marrow, and with the help of that biopsy block, we can investigate further within additional investigations like immunohistochemistry, that is sometimes important in diagnosis of uh, leukemia. Next, the important tests are molecular tests. By molecular test, we sometimes detect specific genetic or molecular abnormalities, and to identify those abnormalities helps us to understand the prognosis of the disease. There are some serious or severe types of disease. There are some less severe types of disease. So by looking at the molecular markers, my genetic markers, abnormal chromosomes, we usually first get an idea about the prognosis of the disease. Also, sometimes specific genetic abnormality has a specific therapy. That means if some of these specific abnormalities present, then we can use some specific drugs to treat that condition. So molecular tests are important first to categorize the disease, to have an idea about the outcome of the disease. Also, we sometimes, depending upon the molecular expression, we can guide the therapy as well. Now, acute leukemia is such a condition that we have to diagnose the condition as early as possible. There may be minimal delay in diagnosis, and we have to first investigate. We have to do a peripheral blood film, CBC, bone marrow examinations. Sometimes molecular, most of the times, molecular and genetic markers are done to guide the therapy, to assess the outcome of the disease. So first we investigate, then there is a plan for therapy. In therapy there are chemotherapy, there are immunotherapy, targeted immunotherapy, there are presence of sometimes there may be role of radiotherapy also. So there are a lot of treatment options are there. So in this vlog, we actually today have learned about leukemia, but this is only the basics of leukemia. There are a lot of things that need to be said, but today I'll be signing off now. In next vlog, I'll discuss about some other topics. uh, Please share your opinion, do like, do subscribe to this channel, and don't forget to hit the like button as well. As thank you.